Welcome back to Open Line tonight. We have Clint Kelly here from the Kelly firm talking about medical malpractice, one of the most, the third leading cause of death, preventable, or third, you say it, because you say it better than me.
Oh, you just said it right. It's the third leading cause of preventable death in the United States.
Unbelievable.
Yeah.
Third leading cause. All right, let's hop to the phone lines. We've had lots of great questions tonight. Want to get to more. Lori is on the line. Lori, thank you for calling in and being part of the show. What is your question?
Yes, I was calling in because 10 years ago, I had a scan done on my hand, and it showed that I was having erosion going on then. I was not told, but the only thing I was told verbally was that I had arthritis in it. Well, jump ahead 10 years now, the tumor had grown around my thumb and had gotten so large it had eaten a hole, and as well as it ate through my tendons. And my question is, do I have a case against the hospital for not giving me that information, allowing me to make that choice?
Lori, that's a tough situation. Legally, it depends. There is an exception to the statute of repose and statute of limitations. There are two different doctrines. I won't get too far in the weeds on this, but the bottom line is you have to prove that the physician fraudulently concealed information. And fraud is a big bar to climb over. Basically, you have to prove that the doctor knew about the condition and purposely withheld that information from the patient. That would constitute a breach of the standard of care. And it's hard to prove to get past that 10 years. And of course, there's the question of whether or not, you know, how much injury would have been prevented had Lori been informed of the facts.
My tendon was ate through, and now I'm in physical therapy now.
It seems to me 10 years you would have a good track record to say, hey, if I had been properly diagnosed and notified of this condition, it would have prevented the shape I'm in now, because 10 years is a long time. But proving fraudulent concealment is extremely difficult against a physician. That's like 1 in 1,000 type situations.
I mean, it basically has to be laid out. You got to have hard evidence, right?
It does. You almost have to have somebody who was working with the doctor say, you know, he told me he was hiding this, or he told me he didn't want to reveal this to the patient, or there would be some type of documentation leading someone to look at it and think that doctor tried to hide it.
What if it's just a bad doctor who makes a really bad call and there's no ill intent there, they just maybe didn't see it or knew about it but forgot there was something you could actually do?
The radiologist who didn't tell the doctor.
Right. Then it's probably not a viable case simply because there's not that fraudulent intent. When 10 years go by, the law presumes, look, you got to do something about it.
Yeah. Well, Lori, I'm sorry we couldn't help you out a little bit more. It's probably not the news that you wanted here, but I do appreciate your phone call. Let's jump to Cheryl. She's on the line for us tonight. Cheryl, thank you for being with us tonight.
Hi, how you doing today?
Good. Make sure you go ahead and turn down that TV and just listen to your telephone.
Yeah, I did. I
Okay.
turned it down. Well, I was in the emergency room about a month ago, and the X-ray technician, she took me back to the X-ray room, and she X-rayed my foot, and she touched up my foot with an open hand, and she said, "Oh, I didn't know that. They didn't tell me that you had a open wound on your foot. So you should have had gloves on." So I ended up getting a infection on my foot. And do I have a liable claim to file?
How's your foot doing right now, Cheryl?
It's still infected.
Well, has a doctor given you a prognosis of how it's going to recover or heal over time?
I'm still in the process of getting it well.
Are you taking antibiotics?
Yes.
Are they using a wound vac, which is, it looks like a little device they put on top of your foot to try to get the infection out?
No.
Okay. You may have a case, but it sounds to me the way you're describing this as if the damages are going to resolve over time. In other words, you should be able to make a pretty good recovery if it's a basic infection that responds well to antibiotics. Now, you know, someone touching an open wound on your foot when you're going in for an x-ray is, I don't understand that. That just boggles my mind that those things still happen. And I'm glad Cheryl brought this up, because Carrie, one of these studies that are out now, that actually the doctors who were studying their own malpractice said, you know what the #1 thing they could do to reduce malpractice cases?
What?
Wash their hands.
That simple. Really?
It's, you know, it's something that was so standard years ago, but because they're seeing so many patients, and it's not just doctors, it's nurses and
Sure.
other providers, they either don't have the time or the inclination to wash.
Wow.
And so a lot of people get infections who otherwise shouldn't have. Cheryl may be one of them. I don't know. But it sounds like Cheryl's going to make a recovery.
Let's hope so. And if she
Yes.
doesn't make a recovery, then even just when you make a medical mistake, that does not lead to a medical malpractice claim.
That's correct.
Okay. Okay. Let's hop to Chris here. We have Chris on the line. Chris, thanks for being part of the show tonight. What's your question?
Yes, ma'am. I have a question. If you have, they're just now finding out a brain injury, possibly from a car wreck. Like I've had 3 bad ones where people have hit me, and this last one was reared in September. I know the time went by, but, you know, I'm just now discovering this. There's nothing you can do. Is that correct?
Well, what do you allege went wrong?
Well, I'm just now getting my memory back. It's taken a while to get my memory back.
But I mean, did you get brain damage from a wreck or brain damage from bad medical care?
Well, I'm not sure. It's from Vanderbilt is my doctor's office down there, and every time I get where my doctor's at, and every time I get hit, they keep taking me to here, which is St. Thomas, and I mean, I throw a fit. I got to go to Vanderbilt, and they keep taking me to St. Thomas, and Vanderbilt, I have to call down there and reschedule it, and I'm having to get back in down there, and they're going to do all these tests all over again. But, you know, the time I thought it was getting better, but no, the headaches just came back, and they're pretty sure I have a brain injury at Vanderbilt.
But it sounds like it's from the car wreck.
It
Right.
didn't start hurting me again like hey, this last one, you know, my head hit the steering wheel, and before a guy hit me head on, I don't know how I'm still here. I mean, it was unreal.
Did you bring a claim against the person that hit you head on?
I did, but it was nowhere near what it should have been. I mean, it was, you know, I was off work 3 years, got fired from my job. I mean, you know, I was out in the hospital. What could I show up at work?
Yeah, that doesn't sound like a medical negligence case to me. That sounds like a case in which you got an injury from a car wreck and you're having some difficulties in getting the right medical care that you want to get or going to the right hospital. But that would
When
be...
they put you in the ambulance, they're supposed to stabilize you at the nearest hospital, the way I understand the rules. But are they not supposed to transfer where you're telling them to because it's your insurance paying for it?
Not necessarily. You are absolutely right that you have they have a legal duty to stabilize you. There's an emergency medical federal act on that.
This man let me go home, and then Vanderbilt said, why didn't they send you on down here? I had open heart surgery at Vanderbilt. You can't make that up.
Yeah, I know. And I had to
I
learn...
am not no regular patient. They tell me at Vanderbilt, why are they not seeing you down here? Vanderbilt's getting upset.
Well, Chris, let Clint answer here. I'm going to put you on hold so you can hear his answer.
I used to think that you had the right to be transferred anytime and under any circumstances that you want. But whenever insurance is involved, there are certain criteria that the hospitals and the physicians, and it's the physicians who discharge patients, not the hospitals. They're the ones who have control.
Okay.
There's certain hoops they have to jump through to get someone transferred because they can't transfer someone if they think that the transfer could potentially make the patient worse, or if they think that the insurance will not cover the care at the next stop. Now she says, look, I've been to Vanderbilt or I've been to other places before, why can't I get transferred now? And all I can tell you is that there are certain rules that have to be followed before a transfer can take place.
Okay. Very good. Let's see if we can check in with Ernest here. Ernest, thank you for waiting your turn. What's your question tonight?
Yes, my wife she passed away at the beginning of this year. She'd gone to a pain clinic, and I believe they over-medicated her because she had taken her medicine, and when I come home from work, I found her passed away.
I'm so sorry.
I've been told many times by different attorneys that they couldn't help me, but, you know, keep looking. Do I even have a case, or do I just give up and go on with life?
When did she pass away, Ernest?
January the 16th.
All right. And did you have was there an autopsy done?
Yes, there was.
Okay. And did the medical examiner conclude that it was a polydrug overdose?
Yeah, mixed medication intoxication.
All right. And how long had she been going to the pain management clinic?
Probably about 2-3 years.
Okay. Did she have...
They kept upping her medication.
Did she have prior addiction problems before going to this pain management clinic?
Do what?
Did she have prior addiction problems before she went to the pain management clinic?
No, sir.
All right. So this would be the first time that she arguably had an addiction.
Yes, sir.
All right. You might have a case, Ernest. I tell you what, years ago I didn't touch these cases because I didn't think I could win them, because the doctors would inevitably blame the patient for the addiction and say you should have taken the drug within, the normal prescription dosage.
Well, she was taking the prescribed dosage.
Well, that begs another question, and if she was taking the prescribed dosage, how would you have a polydrug overdose?
The doctor prescribing too many of the alike kind medications.
All right.
Medical examiner told me.
Ernest, what I want you to do is, will you call my office in the morning and ask to speak to Nurse Kathy?
Okay, which?
It's up on the screen. It's 615-824-3703.
Okay.
And we're going to put that up again, Ernest. So if you didn't catch it this time, we'll put it up again. So just keep your pen and paper
Nurse
heavy.
Kathy. And Ernest, what I'd like you to do, please, sir, is find out exactly what medication she was taking at the time of her death and what the dosage was.
Everything.
Well, I know. Well, we need to know at the appropriate time so that I can make a judgment as to whether or not this physician and also we need to know who was prescribing this, so I can make a judgment as to whether or not this physician was negligent.
Okay, Ernest, so you have some homework to do and some things to gather, but go ahead and make that phone call because that January date is coming up.
Yes, thanks, Ernest, for calling.
And just in case Ernest didn't catch it at the beginning of the show, there is a statute of limitations.
There
1
is
year.
1 year, and you want to get a decision in on this thing within 30 days.
And you just have to file the intent, right? It doesn't
Correct.
have to be resolved. It doesn't have to go to court within 1 year. It has to be, the notice has to be sent.
That's right, and that will get you another 120 days of time in which to, if you need to investigate further, you can.
Okay. So hopefully that information helps today. We're going to take another quick break. We have time for more phone calls right after the break. If you want to call during the break, the number is 615-737-PLUS. We'll be right back.